Welcome, everyone. Today we're going to talk about zoonotic viral diseases, the viruses that jump from animals into people. It's a big topic and honestly one of the most important in modern medicine because most of the outbreaks you've heard about, Ebola, COVID, bird flu, they all started this way. Over the next few slides, we'll walk through how these viruses cross over, how they show up in human patients, and what you can actually do about them. I want you to leave today able to spot the red flags and ask the one question that often cracks these cases open. Have you been around animals? Let's dive in. Start with the big picture. Zoonotic just means a disease that spreads from animals to humans, and spillover is that moment of crossover. Here's the headline number. Somewhere between 60 and 75% of new infectious diseases in people come from animals. That's not a coincidence. It's driven by things we're doing. We're clearing forests and moving into wildlife habitats, trading live animals, packing livestock together, and a warming climate is pushing animals and insects into new places. This is why people talk about One Health, the idea that human health, animal health, and the environment are one connected system. You can't protect one without watching the other two. Rabies is the one I never want you to forget because it's almost always fatal, but almost always preventable. Worldwide, most human deaths come from dog bites, though bats are a major reservoir too. Bats are the major reservoir in the U.S. The virus travels along nerves to the brain, which is why incubation can take weeks to months. Patients start with vague symptoms, then develop the classic furious form, agitation, and that striking fear of water and air. Here's the part to burn into memory. Once symptoms appear, it's essentially 100% fatal. But if you give post-exposure prophylaxis early, wash the wound, give the vaccine, and an immunoglobulin for bad bites, it works nearly every time. So a rabies exposure is an emergency. Don't wait. Filoviruses, Ebola and Marburg. These are the viral hemorrhagic fevers that make headlines, and for good reason. Average fatality sits around 50%, and it's climbed as high as 90. Fruit bats are the natural reservoir, and once it's in people, it spreads through direct contact with body fluids, which is why hospitals and funerals can amplify outbreaks. Clinically, it starts dry, with fever, aches, and feeling lousy, then turns wet with vomiting and severe diarrhea. And here's a myth to bust. Dramatic bleeding isn't always present, so don't wait for it. The good news is Ebola now has approved antibody treatments and a vaccine, though Marburg still doesn't. Early supportive care saves lives, and so does isolating the patient fast. Nipah Hendra, the Henipaviruses. These come from flying foxes, those big fruit bats, and they reach us through go-betweens. Pigs in contaminated date palm sap for Nipah, horses for Hendra. After about 1 to 2 weeks, patients develop fever and brain symptoms, headache, confusion, encephalitis, often with breathing problems too. Nipah is genuinely frightening. Fatality runs from 40 up to 75%, and it can spread person to person. You'll see recurring outbreaks in Bangladesh and India. There's no specific treatment and no human vaccine yet, so care is supportive. The key here is prevention. Avoid sick animals, protect the food supply, and use strict infection control. Coronaviruses probably need no introduction after the last few years. All three of the big ones, SARS, MERS, and the COVID virus, trace back to bats, usually through an intermediate animal, civet cat for SARS, camels for MERS. Notice how the fatality rates differ wildly. SARS around 10%, MERS a brutal 35%, and COVID much lower, but far more transmissible. And that combination is exactly what made it a pandemic. Clinically, they're respiratory, ranging from a mild cold to pneumonia and full-blown ARDS. We have COVID vaccines, antivirals for severe cases, and good supportive care. The bigger lesson is surveillance. These viruses are still out there in bats, and we want to catch the next jump early. Avian and swine flu round out our list, and this is the one that keeps pandemic planners up at night. The natural home is wild birds, but the virus spills into poultry, pigs, and newly, dairy cattle, which is why H5N1 has been in the news. Right now, human cases come from close animal contact, and person-to-person spread is limited, so the current risk to the public is low. But here's the catch. Flu viruses swap genes easily, and if a bird strain picked up the ability to spread between people, that could be a pandemic. In reported human H5N1 cases, fatality has historically been high. We treat with antivirals like oseltamivir, and the real defense is surveillance and culling infected flocks. Let's bring it home. If you remember nothing else, remember to take an exposure history. Ask about animals, bites, raw foods, and recent travel, because that's what points you towards these diagnoses. If you suspect a hemorrhagic fever, don't be a hero. Isolate the patient, put on your PPE, and call public health before you start poking around. A rabies exposure is a clock is ticking emergency. Give prophylaxis. Don't wait for confirmation. And notice the pattern across this whole talk. Most of these have no magic cure, so early supportive care is what saves lives. Finally, this is why One Health surveillance matters. It's our best shot at catching the next spillover before it becomes the next outbreak. Thanks for joining, and if you found this useful, please like and subscribe. Thanks again, and see you next time.